BrahMos. Stealthy, lethal, precise. It flies at 3 times the speed of sound and cuts through a warship like a hot knife through butter. China's navy has threatened its neighbors, and they are turning to the BrahMos for protection. The warship killer. This and more streaming on world's first news OTT, News 9 Plus. Download now.
Hello and a very warm welcome. Thanks for tuning in to News 9 Live. I'm Kabir Naqvi and you're watching a very urgent broadcast. If not urgent, well, very important nonetheless. Because in a concerning turn of events, the Nipah virus has resurfaced in Kerala, claiming 2 lives and sending fear waves throughout the region and the state. This deadly virus has prompted swift action from the authorities, with the centre rushing in the experts team to the state of Kerala, intensifying surveillance measures, establishing a dedicated control room. In basic essence, surveillance has been completely beefed up. It has been tightened. Now, as the situation unfolds, we're going to provide you with the comprehensive coverage. All you need to know about the Nipah virus. Only today have we learnt about Den 2, which is another stronger variant of the dengue virus. What's up with the Nipah virus in Kerala? Well, we'll delve into the Nipah outbreak, examining its potential implications for the public health and safety, specifically for the state of Kerala. Moreover, we'll explore why Kerala seems to be particularly vulnerable to this recurring threat. The health department has launched a massive contact tracing operation as well, identifying hundreds of potential contacts with the victims, the 2 people that have died. Now, it's a point to be noted here is that about 150 odd contacts of one of those 2 victims are all from the medical sector themselves. The World Health Organization, on the other hand, has emphasized that awareness and preventive measures are going to be crucial in combating Nipah. We're going to discuss all these critical steps and their role in reducing the risk of the Nipah virus's infection. Stay with us as we navigate and traverse through this alarming situation and try to unpack why Kerala is vulnerable here, analyze the response strategies and keep you informed about the latest developments on Nipah virus. Your safety, ladies and gentlemen, and well-being are our top priority, and we're here to provide you with the insights that you need. We have experts with us on the panel. Dr. Sulfi Nohu, State President for the IMA Kerala. Very warm welcome to you. Dr. V. Ramankutti, Public Health Expert from Kerala, also joins us on the broadcast. Gentlemen, do stay on with us, and thank you for patiently waiting. Let's quickly listen in to what the Union Health Minister and the State Health Minister had to say on the Nipah virus outbreak in Kerala.
केरला में ऑनरेबल हेल्थ मिनिस्टर से बात की है। उन्होंने मुझे बताया है कि 2 लोगों का निपा वायरस से डेथ कंफर्म हुआ है। हमारी भी एक्सपर्ट टीम केरला में पहुंची है। अभी 4 पेशेंट सस्पेक्टेड है, उसका सैंपल लेके NIV पुणे, नेशनल वायरोलॉजी इंस्टीट्यूट पुणे में भेजा गया है और वहाँ जो गवर्नमेंट मेडिकल कॉलेज है वहाँ कौन से प्रिकॉशन लेना, ये सारी व्यवस्था उसके लिए अलग से PPE किट सारा भेज दिया गया है।
That's reported in Kozhikode district. So, health department has given a health alert to the entire district. So I am here we are having a meeting now at 10:30. So after the meeting, I will give you more details. Thank you.
Well, all right. Dr. Sulfi Nohu, I'm going to begin with you. First and foremost, even before we touch upon the aspect of why Kerala here is vulnerable, First and foremost, tell the viewers what is the situation like right now on the ground, and should there be fear amongst the people? What's the doctor community's verdict on the current situation? Nipah is not new to Kerala, not new to India as well, but why Kerala again? Even with COVID-19, Kerala reeled under the threat of COVID-19 and the brunt of COVID-19 for a longer period when compared to other states, across the country. But we'll touch upon the Kerala aspect in just a bit. First and foremost, the ground zero reality, Doctor.
Yeah, actually, as the news reports are available, we can see that the death has happened, and also some patients are admitted. But the basic thing is that it's not going to spread to other districts or maybe to the entire Kerala. It's not like COVID-19 or maybe even dengue fever or not like even in a viral fever or anything of that sort. The situation is totally under control, but we have to do some work there. But definitely, we are under control. The team is looking for all the contacts, and they are taken care of. And also the patients who are admitted in the hospital, they are given good treatment, and definitely the contact tracing and their isolation and their follow-up is very, very important. Yeah, the most important thing is that we were able to identify the Nipah much earlier. Once that unfortunate, sudden, unexplained death has happened, the people were, the doctors were after it, and they found that they suspected that it may be Nipah, and then they did all the tests. We actually, the diagnosis was maybe we could identify the Nipah in less than 6 hours. Probably in other part of the country and other part of the world itself, the Nipah may not be identified in such a fast pace. That is one reason, and maybe some I can say that some part of the country or maybe the world may be missing the Nipah also. So that is one reason if you think in that line. But the basic thing is that we have to be very alert regarding the contact tracing and also identifying and isolating these people. But definitely the most important thing is Nipah is not a public health problem at the moment in Kerala, not even in India, because it's a self-limiting illness. It has happened in many part of the world. Yeah,
you're absolutely right, Doctor, because of course these are just 2 deaths and 2 cases currently. So of course Kozhikode district reeling under a high alert is something that people can understand, and nobody's trying to spread fear amongst the population. Nobody's trying to say that Kerala is reeling under a Nipah outbreak. These are just cases of Nipah that have now come to light. But from a public health perspective, Dr. Ramankutti, how dangerous is this contact tracing? Because we are learning that one of the victims of the recent Nipah deaths, they were in close contact with about 150 other medical personnel. Now those medical personnel people are going to be treating others as well. Incubation period has to be taken into account as well. So how dangerous is that particular aspect when we're looking at contact tracing?
You are right. Actually, the danger is that usually comes to light after the cases have actually appeared, which means that already they have come in contact with a number of people, which makes it all the more risky. So you have to go back and find out who they have been in contact with, and then try to find out if they have been infected or not, which is a challenge for the health system. So that is a real challenge. And as you said, rightly pointed out, a lot of medical personnel have come into contact with the patients because they have been in hospital. So that poses a special danger. So I think, but the system is up to it, as Dr. Zulfi pointed out. See, the early diagnosis has been one good thing, probably because we have been sensitized by the previous epidemic. We were able to suspect, we had a high index of suspicion. So we did the tests, and Kerala found out that it is Nipah, which is a good thing. So we can go on to containment measures. Yes.
All right, all right. You know what, Dr. Zulfi, let's circle back to the basics over here. I was reading what causes Nipah virus again, because it's a great time for you to brush up and revise on the Nipah virus yourself. Everybody understands the preventive measures, but what causes Nipah? bodily fluids, saliva, urine, blood of infected animals, infected pigs, bats. Could you throw some light on that? Because there's a lot of discrepancy in terms of information out there on the internet, because on the internet you get information about everything. You talk about, an oral sore, it will tell you have cancer. So for the viewers, tell them in layman language, what is Nipah virus, what causes Nipah virus?
Yeah, absolutely. You see, there are a lot of social media rumors happening. It's starting all from all the WhatsApp universities. Basically, this virus usually comes from the bat, fruit-eating bat. That's the first source, preliminary source. Pigs and all other things are also there, but preliminary it is coming from. It is proven beyond doubt that it is coming from fruit-eating bat. So their saliva, their excreta, and all those things. If it is infected, if the fruits are available are infected with the secretions, it may be the root cause. And maybe some other sources also. Man-to-man contact is also there, but the index case usually comes from the bat, fruit-eating bat. Now the preliminary symptoms, the preliminary symptoms are just like another viral fever. It has body pain, fever, cough, throat pain, and all. But the dreaded complications like encephalitis, that is infection of the brain, and also the respiratory tract causing respiratory failure. These are two dreaded complications of Nipah virus. So we have to be careful about that.
Because the two deaths that happened in Kozhikode, one was due to liver cirrhosis, I believe, and the other one was a respiratory, failure. If I'm not wrong, the liver was attacked due to the virus. Is that so, doctor?
No. I don't think so. I have no information or no such information. This time, both these patients died of respiratory failure. Usually it happens in encephalitis and respiratory failure are two entities. And as available information, the two persons died because of respiratory failure. But definitely there will be multi-organ failure at the end stage. Maybe then the liver functions also may get affected, but then basically it's a respiratory failure which has happened in Kozhikode. So we have to be careful about the alarming symptoms of respiratory failure and maybe the encephalitis. Like, the patient will be drowsy, the encephalitis is causing, the patient will may develop a seizure, like convulsions, like episode, and maybe patient will be disoriented. All those things are pointing towards an encephalitis. And respiratory failure, you have chest discomfort, you have breathing difficulty, you may get a hemoptysis, and all those things may develop, and it can lead on to respiratory failure. And this is a high alert situation, and these patients has to be shifted to the intensive care unit and given proper treatment. At the moment, the contacts are treated at home itself. So believing that a good number of patients may develop asymptomatic cases will be there. So we are keeping a lot of patients at home also. So these are the main symptoms, and the danger signals has to be identified.
Right.
And yeah, exactly. Yeah.
No, because there is a silver lining here. I'll tell you what, because we all know that Kerala has a robust health system in place, certainly. And the silver lining here is that there is no better place for an outbreak than Kerala, because it has that robust health system that can tackle it in the right kind of prices. People do travel to Kerala for their treatment as well. Coming back to Dr. Ramankutti with us on the broadcast, public health expert, and from a public health point of view, sir, how important is to trace the impact of the virus or diagnose the virus in the early stages? And even as I'm saying that, my question is two-pronged. The second aspect of this question is that the World Health Organization says that no particular treatment is available when Nipah virus is being looked at. The only thing that one should focus on is community engagement and spreading awareness. Do you think there are right strategies in place, specifically when we're looking at the state of Kerala?
Yeah, that's a very difficult question to answer, because see, as has been said, it looks like any other viral fever in the beginning. So we cannot go on, tracing all viral fevers, because that is a humongous task. So actually, we are lucky that we have been able to diagnose this very early because of the high index of suspicion. That is the only way you can trace it. Unless you test it, you won't find it. So since the death occurred, I think that is what triggered the doubt, and then So unfortunately, the first person or the index case usually suffers because only when the death occurs, people find out that this is a dangerous virus. So once we have that, then we can be careful and we can close the ring as it is and isolate them or isolate the contacts and find out who the contacts were, etc. So the challenging thing is to keep surveillance, and I think we don't have even now. We had a previous epidemic and it has come again, so we really don't know why it occurred again. We have
But the
really
people
not
of
found
Kerala
out.
battled COVID-19 so well. In terms of community engagement, that's what I'm trying to focus on here, Dr. Ramangutti. Do we have the right strategies in place when the WHO says that, boss, the only thing that will work is public awareness? And you just mentioned that it's difficult for people to understand what is common influenza, what is common viral fever, and what is Nipah virus when the body is infected. So in terms of community engagement, the right steps, are we taking them?
See, in the case of something like COVID, which spreads very fast through the air, community engagement worked very well because lockdowns worked. We were actually following the protocol. I think
Right.
better than many other states. So that is definitely a plus point in Kerala. But on the other hand, disease like Nipah, which is actually rare, but at the same time very fatal. So that is the problem with a thing like Nipah, because you cannot actually frighten the people into reporting every viral fever, because that is going to be very impractical, because any seasonal fevers, it may be most of them will be just viral fevers. So that is the problem. So when something really, but as far as community engagement goes, I think as you have put it rightly, Kerala is very good in that sense that people have an awareness, and even if they have serious symptoms, they do go to hospitals. That makes it easier for us, the medical people, to diagnose the illness, and maybe if it is dangerous, then trace back
Right,
the
right.
contacts.
You know what, Dr. Sulfinohu, we're going to touch upon Kerala just next, but before that, one final aspect of basic journalistic diagnosis of this virus, the prevention. So many, you open internet, again you get 20 things that you need to do, from amla juice to citrus, all remedies are there. And according to my father, the best one is what his father taught him. But you're the doctor here. Tell the viewers what are some preventive measures that people can pick up, because we're running the symptoms over here, some of them really severe, coma, encephalitis, and of course can lead to death as well. So preventive measures, Dr. Nohu.
Yeah, exactly. You said it actually. Whenever there is an outbreak, big outbreak of Nipah or COVID and COVID-19, then all the unscientific treatment methodologies and probably the
WhatsApp University, doctor,
mythologies will
WhatsApp
come.
University.
Yeah, WhatsApp universities. They'll come out with so many things. The basic thing is you have to depend upon reliable sources and check it again whether it is coming from reliable sources. Most important thing is, if there are three things. First and foremost, we have to isolate those patients and all. We have already discussed that. Second and third is very important. Second is that you should not take up the fruits the fruits eaten, the remnants of fruits eaten by the vowel, the bat and all. So you should avoid that. And fruit juices with a probable chances of infected with the bat urine and all, you have to definitely avoid that. It doesn't mean that you cannot take fruits. You can definitely take fruits after cleaning. Good fruits after cleaning, you can definitely take. There is no ban in fruit eating. That's a very, very important point. And the second thing is, that is also very important. Those people coming into contact with suspected cases of Nipah, they need to be isolated, and they have to give the information. They have to give the information to the authorities, and they have to go for isolation and all. They have to obey all those things. And now, if anyone develops a fever, cough, body pain
Right,
and all,
right.
with respiratory symptoms, please do wear mask in those areas in which it is suspected. Please do wear a mask and go
here in the national capital region,
hospital.
doctor, winter is going to come very soon. It is Deepavali season. In the national capital, we start talking about air quality index. Come October, we start talking about AQI. So nevertheless, we're going to nonetheless start wearing masks very soon. Finally, one last medical question, Dr. Nohu. Any vaccine, antiviral dose when we're talking about Nipah? Because according to my limited opinion and research, there's nothing out there per se. Have we made significant advancements in that particular domain? How to treat
First and foremost,
cure
yeah,
Nipah?
yeah. First and foremost, regarding vaccine, we try to develop vaccine. I think Dr. Amankuti sir also will agree that we try to develop vaccine when the community is affected in a massive way. Very good number of people are affected. Then only we try for a vaccine. Where the research on the vaccine may be going on, but then there are no vaccines available. But there are some antiviral drugs available, which is being tried, but not conclusive evidence, but definitely it gives some results in some cases. So we are trying some antiviral drugs, and also some monoclonal antibodies and all. Some antibodies are also there that they are being tried. The most important thing is preventing those patients going into complications. That is very important. So if they are going into complications, we can give all other supportive measures like ventilations, all other oxygen supply, oxygen mask and all other supportive measures for those patients going into complications. That is very important. If we can intervene earlier, we may be able to save many lives. But there is no concrete drug. This drug will cure this illness. It is not there. But we have definite treatment for Nipah.
All right. Dr. Amankuti, I'm going to give, I want your opinion on the same as well. Dr. Nohu spoke about monoclonal antibodies. He spoke about, some drugs that are out there that are being tested, but there is no pressure. So until and unless we have a major death toll, let's not expect a vaccine at all. Is that the case?
Yeah, that is definitely, I would agree with that, because vaccines, there is a big economic aspect that is.
But scientifically speaking, doctor, scientifically speaking, sorry to cut you short, don't you think, that's a situation where we're shooting ourselves in the foot? Don't we have plethora of examples in front of us where we shouldn't wait for more deaths to happen? Why is it that the Nipah vaccine is on the backbench, on the back burner? Why not prioritize when something like this happens every now and then?
That is what I'm trying to tell you. If you are in government, your priorities are different. If it's a very rare disease, and to invest so much of money in research on that vaccine, well, it takes a really courageous government to do that, and I don't think we are there yet. So we have other priorities, so we will go by that. But certainly, if somebody finds a vaccine, it will be wonderful. But then again, this problem is, for such a rare disease, do you want to expose the population to mass vaccination? Because any vaccine has its own problems. So that also is an issue.
You're right. You're absolutely right. Even with the COVID-19 vaccines, there are so many reports that still do the rounds, conspiracy, theories that are doing the rounds. So many people who still haven't taken the vaccine still think it's going to kill you. But let's not forget a humongous task that the government of India achieved with the COVID-19 vaccination. They were testing times, and I think the Indian government came through on that. People will have their opinions on the vaccines. Let's not digress from the topic over here. Coming back to the aspect of why Kerala happens to be a vulnerable state when we're looking at Nipah virus. Now, I have some information, and of course, the doctors on the panel will help us understand whether, where is it that I'm actually faltering. Now, the Nipah virus has repeatedly resurfaced in Kerala since 2018. A Reuters special investigation, and it was a really nicely done investigation. I was reading the magazine pamphlet of it. It said that humanity's drive for resources and exploiting these resources are destroying the wildlife habitat of bats. Now, these wildlife habitats carry tens of thousands of viruses and creating conditions ripe for a bat-borne disease to spill over to humanity. Now, these areas where the vulnerability of a bat-borne disease to spill over into humanity are called jump zones. Kerala's eastern side has a lot of these jump zones. Apart from that, doctors, I think Kerala has 5 international airports also. A lot of money that Kerala is also bringing to the Union Exchequer, but at the same time, lot of international people coming in and out of Kerala as well. That's another reason why people started targeting Kerala during COVID-19. That you've got too many people coming in and out of it. That's one reason. But then again, I always say the silver lining here is that there is a robust Kerala Health Department. But I'll go across the panelists one by one. Dr. Nohu, first to you. Why do you think the situation is a little peculiar in the case of Kerala?
So regarding Nipah, I think we need to do some more research regarding why it is happening at particular places in inside Kerala. So we need to do a lot of research on that, and we have to analyze the data, and we have to do some research work there, definitely. But basic thing is that urbanization, definitely it could have it may be one point, but there are other issues as well. But so we have to do a lot of research and find out why it is becoming a spot for Nipah, especially Calicut and some other neighboring places. So we need to do. But the basic thing is that for any infection, you need several factors. Like you need the host, you need the microorganism, you need the environment. Everything is conducive for a Nipah in Kerala, maybe in some districts, and so we need to do a concrete evaluation, and then only we can say that why it is happening more in Kerala. But the positive thing is that these conducive atmosphere are not there all over Kerala. There are some pockets in which it's happening. We need to do a lot of study on that. That's my take on this point.
All right, all right. Coming to you, Dr. Ramankuti, what's your perspective on this? Why Kerala is so vulnerable? Again, I'm not trying to, put across the sentiment that it is only Kerala that is dealing with this. It has happened across the country. It began in Malaysia from the place where it gets its name as well. But why do you think Kerala has a little peculiar tete-a-tete with Nipah virus?
You see, if you look at the places where Nipah outbreaks have come, Malaysia, Bangladesh, see, all these are areas where there is a very dense tropical rainforest with a very dense population also living close by. So, which means that there is a peculiar ecosystem which is making this vulnerable. And as you say, there is a hypothesis that forest destruction may have actually deprived the bats of their niche, and then they are coming out and all that. I don't know if that is true, but that is a very plausible hypothesis. I think we need to work on that. And that may be one of the reasons why these areas are more vulnerable. So that has to be looked into. But as an epidemiologist, as a public health specialist, what is more interesting to me is the question why it is happening in Kozhikode. You have 14 districts and coming again to Calicut. Of course, there have been doubts about Nipah in other districts, but this major outbreaks have happened in Kozhikode. Is there anything with it, in that ecosystem which is making it vulnerable? I don't know. So I would say that we have to do more research. We have a kind of we are very good at reaction. That is, once it has happened, we know how to contain it, but then when there is a gap and then people just forget about it. I think the research has to go on. And we have to go into a mode of what we call One Health. There's animal health, human health, environment. Everything is, we are in it all together, especially in these days of climate change. We have to realize that, it is making or breaking, once and for all. So we have to look at what is happening to the ecosystem, what is happening to the animals. And I think that has to be seriously looked at. And maybe that may point to certain vulnerabilities that Kerala may have. Plus the fact, of course, that we are a thickly populated state. And if you look at it in the habitation pattern is very spread out. It's not like people cluster together in cities or villages. People live all over the state. So they live right into the forest also, very near the forest also. So that all may contribute to this.
Absolutely. Pertinent points that you've made there, Dr. Ramankuti. Firstly, of that plausible hypothesis and how we could spend a little more money. If we're not spending that kind of money on the vaccine, let's spend a little bit more money on that hypothesis. And of course, on Kozhikode's, specific ecosystem. Maybe that is something that can definitely be studied. Dr. Nohu, now that we've got that Kerala peculiarity and why Kerala is vulnerable angle out, people can debate it for hours on end. I'm more interested in telling the viewers and people who are watching us, and of course, all the viewers who are watching us, get down in the comment sections if there's any question that you'd like to ask. We've got a public health expert, an epidemiologist, and of course, the state president for IMA Kerala with us on the broadcast. So if there's any question, please feel free and just shoot if you don't mind, doctors. Also, Dr. Nohu, the incubation period. Would you like to throw some light over there? Dr. Ramankuti, right in the start of the debate discussion, was telling us how it's difficult to differentiate between what is a common, viral fever and what is a Nipah-generated fever. So, incubation period, How do you assess that? How can you differentiate? Throw some light for the viewers, sir.
Yeah, actually, it varies. There is a variation in the incubation period. It may extend up to 14 days in some cases. Usually, literature says that it is only up to 14 days, but then it may go up to 21 days. There are some cases reported after 21 days and all. It may extend more. But generally, it's almost almost 2 weeks time is the incubation period, they say. And now the basic thing is that in this season, it's a rainy season also in Kerala. There are viral fever, influenza is there, dengue is there. There are other kinds of fever and all. The basic thing is that if you have a fever, body pain, cough and all, please report it to the doctor. And if you are coming from a high risk area, definitely there should not be any delay. Go to your doctor and treat. That must be the message we have to carry to the general public. It seems the incubation period may vary, but definitely any fever you have to report it to the patient. Don't say that don't suspect that it is going to be Nipah, but then especially the people coming from the high risk areas, they have to go to the doctor and to seek medical attention, medical help.
A public health perspective on that, Dr. Ramankuti?
I have nothing more to add. Actually, what you said is very right. So because this happened, we must have a high index of suspicion, and any fever, any sore throat should not be ignored. They should be reported to the doctor. They should be investigated, especially if you have any suspicion that you have been in contact with an.
It's still early dose right now. It's still very early dose. We've just got two cases. Of course, that we heard the Union Minister as well. Pune Virology Institute will further carry out the sero survey, and we'll get a better idea about what's really happening. But in the coming days, Dr. Ramankuti, what are you hoping not to hear? What are you hoping not to read in the newspapers in the coming days, Dr. Ramankuti?
Definitely, I am hoping not to read about more deaths. I'm hoping that more cases, if they are occurring, will be picked out early and they will be given good medical care and support, and they will survive completely. And also that we are able to contact that, trace all the contacts and contain the infection as soon as possible. So that is my fervent hope.
And Dr. Nohu, even as we're wrapping this discussion up, some previous Nipah outbreaks in the state of Kerala, have we learned some lessons from that can help better inform the current situation, sir?
Yeah, absolutely. We have learned a very good lesson. That's why, see, yesterday also I was talking like this, when there were some suspicions regarding the diagnosis, we were waiting for Pune. But our thinking, not that, it must be something, that must not be something else. If Nipah is there, our diagnosis is confirmed and we can go in the right path. If the diagnosis is not there, then we are back to the zero level and then we have to do the work again. So actually we are happy that in a way, we are happy that it's Nipah only. So we have an experience and we have a set protocol to manage such cases. So I think we have to learn more. Definitely, as Dr. Ramankuti sir said, we need to do a lot of research on this aspect. But definitely the lesson we have already learned. We have experience and we have very experienced doctors in the both private and the public sector. So that's why we are confident enough to deal the issue.
Okay, then, and in terms of students and the young children, Dr. Ramankuti, what kind of specific preventive measures should parents take on that front? Because very soon, I mean, if the cases, and God forbid that happens, but if the cases do start coming up a little bit, then parents are the first set of people that start worrying. And if you've got a younger offspring in the household, then you worry even more. Any word of caution, advice to them, sir?
Yeah, especially not to be eating things which are not clean, like fruits, and as Dr. Sulfi said, not use fruits which have not been washed, and make sure that they wash their hands properly, frequently. Generally, also look out for fever and report early. So these are the things that you can do.
All right then, gentlemen. It seems like and it was a riveting conversation. So much information that was put out. Many thanks to both of you, Dr. Sulfi Noho, State President, IMA Kerala, and Dr. Raman Kuti, public health expert and epidemiologist. Thanks from the bottom of my heart to come out and speak to us, ladies and gentlemen. There you have it. It's not a complete outbreak per se. There are 2 cases, 2 deaths. Surveillance has been heightened. The entire area, the district, Kozhikode has been put under high alert. A central team has been rushed in. So let's not rush to our conclusions just yet. All the precautions, all the treatment, all the causes and concerns is something that we've spoken about. We'll put this video out as a separate entity for you to consume on various News 9 platforms as well. That's all the time we have for you. This is Kabir Naqvi signing off. Stay safe. Keep yourselves, clean, hygienic. Take an account as to what fruits you're eating, and if you're near a jump zone where a backbone disease could spill over onto the human residential areas. But as of now, not a moment of concern. Kerala already has a robust health system, and we've already spoken about how the peculiarity of Kerala being vulnerable is due to a couple of reasons. Some plausible hypotheses over there, some not, but of course no harm in doing and carrying out more research. News 9 will continue to give you all the latest details on the Nipah virus. Even as we wrap up the show, listen into what the Union Health Minister Mansukh Mandavia and the State Health Minister Veena George had to say on the recent developments. Stay safe, keep watching News 9.
केरला में ऑनरेबल हेल्थ मिनिस्टर से बात की है। उन्होंने मुझे बताया है कि 2 लोगों का निपा वायरस से डेथ कंफर्म हुआ है। हमारी भी एक्सपर्ट टीम केरला में पहुंची है। अभी 4 पेशेंट सस्पेक्टेड है, उसका सैंपल लेके NIV पुणे, नेशनल वायरोलॉजी इंस्टीट्यूट पुणे में भेजा गया है, और वहाँ जो गवर्नमेंट मेडिकल कॉलेज है वहाँ कौन से प्रिकॉशन लेना, ये सारी व्यवस्था, उसके लिए अलग से PPE किट सारा भेज दिया गया है।
That's reported in Kozhikode district. So, health department has given a health alert to the entire district. So, I am here we are having a meeting now at 10:30. So, after the meeting, I will give you more details. Thank you.
Pakistan is actually genociding Baloch people. So being Baloch is a crime. If you are a Baloch, it means in the eyes of Pakistan, you don't have any right to live.
The Chinese and Pakistanis are colonizing the Baloch and exploiting their resources.
The Baloch armed struggle will continue unless China withdraws, the Pakistan military withdraws from Balochistan and give Baloch complete authority to decide for themselves.
The Baloch feel that if they don't act now, they will become marginalized.
What lies ahead for Balochistan?
Balochistan, Bangladesh 2.0, streaming now.
With all this gear, you must be wondering if I'm climbing a mountain. Well, let me give you a wider look of this place. This is Asia's largest mountain of shame.
A mountain of waste, almost the height of the Qutub Minar.
When you enter capital cities of some of the biggest countries in the world, you don't have 3 garbage mountains waiting to welcome you depending on whichever side of the city you enter from.
The thing is that a lot of times we talk about landfills only when there's a fire at the landfill. You need to understand that a landfill is at fire almost throughout the year. It's only when the firefighters are not able to douse the fire is when it actually catches the nation's attention, the city's attention, or media attention.
The towering landfills worsen one of Delhi's biggest problems: pollution.
यहाँ पर आप रात को आओ, दिन में आओ, आप 1 घंटे बैठ नहीं सकते बाहर। इतनी धूल, प्रदूषण, महक, आप खाना भी नहीं खा सकते बाहर बैठ के।
Life around the landfill is a curse.
हमारे घर में जो बड़े हैं उन्हें अस्थमा के वो पेशेंट है, आए दिन उनको नेबुलाइजर लगाना पड़ता है।
डॉक्टर ने भी मुझे ये चीज बोला कि यहाँ का एरिया छोड़ के कहीं और चाहिए।
Delhi's garbage mountains are now a fetid symbol of the national capital's trash problem. The question is, who is to be blamed? Watch Delhi's Garbage Mountains. Streaming on News 9 Plus for the Genflix.
मैं इमरान अहमद खान नियाजी सबके दिल से हल्फ उठाता हूँ।
When Imran Khan came initially into politics, he thought his personal popularity would be sufficient for him. It didn't happen.
The retired military generals are openly saying that Imran Khan is a better choice.
Imran Khan may have bitten a bit too much, more than what he can chew.
Implosion. This